Which one of these is currently being used in our societies to treat dry eyes? In this video, I will focus upon what dry eyes are, what causes them, how the condition is diagnosed, and how we manage the condition. I will also delve into how looking for certain quick fixes can lead us down a path of investing our time and money into treatments that currently have no scientific proven evidence. Please keep watching until the end to learn about a treatment that is currently being used in certain parts of the world. At the end of this video, there will be a short quiz. Don't worry, no prior knowledge is required to attempt this quiz. Also, in order to facilitate your learning, I will provide you with certain questions throughout the video to ensure that you remain stimulated. Whether you yourself suffer with dry eyes or you have a family member or friend that does, I am excited to share the information within this video with yourselves. My channel is fairly new, so let me introduce myself to you. I am currently training to be an eye surgeon in the UK, and I am a qualified medical doctor, and prior to undertaking my medical degree, I was a qualified optometrist. There are plenty of videos on the internet and particularly on this platform pertaining to dry eyes. It is such a vast topic area, and I feel that this video will provide you with a succinct overview of the whole topic, so therefore please keep watching. So first, let's specify what dry eyes actually are. We have a layer of tears that typically bathes the front of both of our eyes. Typically in dry eyes, there is a problem with this layer of tears. This then results in dry eyes. A patient with dry eyes may experience anything from having a sensation of gritty eyes, uncomfortable eyes, temporary blurry vision, which tends to improve with blinking, and also it can give one the perception of having an eyelash in one's eye. Typically, the condition affects both eyes. If you haven't already done so, please can you subscribe to my channel? It would mean a lot. In the next section of this video, I will describe how the layers that bathe the front of the eyes are actually made up of three interesting layers and components. An understanding of this will help you to appreciate how dry eyes actually affects individuals potentially in a slightly different way. Moreover, it will allow you to understand how the different treatment options work. This leads me on to my next point, which is some patients can have a diagnosis of dry eyes despite their eyes actually being watery. This is because one of the specific layers of their tear film is allowing their eyes to stream with water. As I said, I will go into explaining the different components of the tears in a short while. Please do comment below and let me know if you have dry eyes, whether a family member or friend has dry eyes, and importantly, also please tell me how it impacts upon you or your loved ones. You may be wondering why people develop dry eyes. The issue could be with the actual quality of the tears, it could be with the quantity of the tears, or it could be with the fact that the tears are not being distributed over the eye or eyes in the correct way. As mentioned earlier, the tear film, or the layer of tears that sits on both of our eyes, is made up of three particular layers. Those three particular layers are the mucus layer, which sits directly on the eye, on the front of the eye, and this layer provides the foundation for the layer above it, which is the watery layer, also known as the aqueous layer. The aqueous layer then has all of the nutrients that are going to be provided to the front of the eye, and then the final layer, which is the furthest away from the eye, is the lipid layer or the oily layer, and the function of this layer is to prevent evaporation of tears from both of the eyes. The tears are very important to the function of our eyes. They not only provide nutrients to the front of the eyes, they also allow a frictionless environment for when the eyelids come over the front of our eyes when we blink, and also they are crucial and provide us with clear vision. What are some of the causes of dry eyes? What we do know is that dry eyes tend to become more common as we age. We also know that through certain hormonal changes, such as when females pass through the menopause or when they are pregnant, dry eyes tend to become more common in these patients. Another frequent association and cause of dry eyes is a condition called blepharitis. Blepharitis is basically when our eyelids and eyelashes are involved in a condition which tends to cause sort of crustiness around the eyelashes, and patients typically complain of gritty and stingy eyes. Ultimately, what blepharitis is doing is affecting the quality of our tears. Another frequently associated condition with blepharitis is a condition called meibomian gland dysfunction. Our eyelids contain several glands which secrete an oily substance onto the front of the eyes through pores. If this oily substance is lacking, as we mentioned earlier, the tears are more likely and more prone to evaporating, therefore resulting in dry eyes. In meibomian gland dysfunction, what tends to happen is the glands become blocked and therefore they are unable to secrete this oily substance. Another common cause of dry eyes is patients taking certain medications. We do know that with certain oral contraceptive pills and with antihistamines, patients can develop dry eyes. Contact lenses can also cause dry eyes, and essentially a physical foreign object in one's eye disrupts the natural tear film, and therefore this can result in dry eyes. And then the final component to touch upon is when patients have certain health conditions, and those health conditions have the association of dry eyes. For example, Sjogren's disease and rheumatoid arthritis. These patients can go on to develop dry eyes. So I've listed many conditions that can cause dry eyes. Do you know of any other conditions that can cause dry eyes? Please do comment below and let me know. Also, at this point, I will ask yourselves a question. Do you think certain eye operations or procedures can result in dry eyes, such as laser eye treatment? Tell me below in the comment section. If you do feel as though you may potentially have dry eyes, it is very important that you attend to see either a healthcare professional, such as an optometrist or an ophthalmologist, or your general practitioner, or in America as they're known, family physician. The reason this is important is because these qualified professionals can take a thorough history from yourselves. This will then help them to identify any potential causes that are present within your case that could be contributing to your dry eyes. For example, are you taking certain medications? Are you using contact lenses? Or do you have any underlying eye diseases or conditions that need to be treated in the first instance in order to improve your dry eye state? A whole host of tests can be performed during your consultation in order to understand and diagnose whether you do indeed have dry eyes. One of the commonly performed tests involves an examination at the slit lamp, which is essentially the machine onto which you place your chin, and the eye care professional typically shines a light into your eyes and examines the front of your eyes. What the eye care professional may then do is use a blue filter in combination with a yellow drop, which is placed into both eyes. It does not sting, and it simply just stains the front of the eyes for a short period of time. They will then ask you to blink and they will observe what happens to the layer of tears on the front of both of your eyes. What they are essentially looking at is how long it takes for the tears on the front of both of your eyes to break down, and that's why the investigation is called tear breakup time. Typically, the tear breakup time tends to be more than 10 seconds. However, it can vary between male and female subjects. Other tests may also be performed in order to look into your dry eye symptoms further in order to try and come up with a diagnosis. Once you have been thoroughly investigated and a diagnosis of dry eyes has been reached, your healthcare professional can then look into what treatment options are available and appropriate for yourself. The reason why it is important to see your healthcare professional and not to just diagnose this condition yourself is because they are in a great position to appreciate your past medical history and apply that knowledge in terms of their decision making. Key decisions that they may need to take involve reviewing certain medications that you may be currently taking that are potentially contributing to your dry eyes. Secondly, if it appears that contact lenses are contributing to your dry eyes, your healthcare professional may engage in a dialogue with yourselves to look into why it is that your eyes are becoming so dry with contact lenses. Frequently, patients tend to wear their lenses for longer than recommended, and therefore that can contribute to dry eyes. The mainstay of treatment for dry eyes is typically the replacement of tears in the form of artificial tears. These artificial tears not only coat the front of the eyes and allow your eyes to feel less irritable and gritty, and therefore they are improving comfort, but they also provide a clear front surface which is smooth, and this therefore improves the clarity of vision which you are achieving. Your dry eye treatment may involve multiple facets, and what I mean by this is you may potentially be using drops to treat a tear deficit. In addition to this, you may also be managing an underlying eye condition such as blepharitis, which is exacerbating your dry eye symptoms. As I mentioned, the mainstay of treatment for dry eyes is tear replacement with artificial tears. There are many different dry eye products available on the market. With respect to dry eye drops, it isn't a case of one size fits all, and therefore your healthcare professional will guide you and advise you on which products are potentially most advantageous and beneficial to you. Before finding the product that is actually most suitable for you, you may find that you will have to try several different drops to find the one that is right for you. In terms of drops to treat dry eyes, they again can come in several different forms. One of the most commonly used forms is what we call an aqueous or drop form. In order to treat dry eyes, we may need to instill potentially one of 3 different types of drops into our eyes. Some patients may very well be using a combination of these different drops. The different drops are artificial tears, which are typically products that we can buy over the counter. We then have thicker gels, which tend to hang around in the eyes for a bit longer and provide more lasting relief for patients' symptoms. And finally, we also have ointments, which typically tend to be used at night because they are oily and they can blur our vision, so therefore they are best used during the night, and their intention is to try and relieve us from dry eyes both during the night and then when we wake up first thing in the morning, our vision and our eyes are optimal. Another treatment option for dry eyes is something known as punctal occlusion. After bathing the front of our eyes, the tears need to be drained, and this is done through a very intricate and complex network of tubing which is around our eyes. Sometimes if there is an issue with tears actually not remaining on the eyes for long enough, what we can do is physically block this drainage channel, and therefore the tears will stay on the eyes for longer and in good quantity. Dry eye treatment can be potentially very complex. The specific issue that you are having with your eyes will ultimately be causing your dry eye state. However, this can be different in different patients, so as well as using artificial tears and or punctal occlusion, we need to be aware of several environmental factors that could be contributing to and exacerbating our dry eyes. What I will now do is discuss several practical real-life components that we need to be aware of with respect to this. Number one, can humidifiers help with preventing the evaporation of tears? The answer to this is yes. Number two, can central heating make dry eyes worse? The answer to this is yes, and therefore having slightly lower temperatures is advisable. We live in a tech society, and basically anybody and everybody tends to use a computer or a computer screen in some way, shape or form. Whilst using these computer devices, we tend to blink less. When we blink less, our tears evaporate, and ultimately we experience dry eye symptoms. In order to manage this, frequent breaks are advised. A conscious effort to blink is advised, and some patients may find that if they plan on using a computer device for a prolonged or extended period of time, prior use of drops can sometimes be very beneficial. However, the above measures do not negate the need for taking frequent breaks, which is not only advisable for your eye health, but also just your general posturing and well-being. Number three, can dusty, smoky or windy environments contribute to dry eyes? The answer to this is yes. Therefore, it is advisable to protect your eyes in such an environment with a physical barrier such as glasses. This may be in the simplest form your day-to-day spectacles, or it may be wraparound sunglasses. Number four, it is important to maintain a balanced and healthy diet. Such a diet should include flax seeds, plenty of oily fish such as omega-3 and omega-6, and lots of greeny vegetables. Number five, if you do wear contact lenses, it is important that you have regular consultations to ensure that you are wearing them in the most appropriate way possible in order to give you all of the benefits of contact lenses, as well as reducing your risk of developing dry eyes. Do you remember this picture that I showed you at the beginning of this video? This picture relates to a form of treatment called Netra Basti. As doctors in training and then later as qualified professionals, we are always encouraged to ensure that the treatments we are advising to patients have a strong evidence base behind them. This ensures that they have a good safety profile, and B, we know that they work. Evidence-based medicine is definitely practiced in the Western world, and it is continuing to spread globally. It is therefore very interesting when I come across videos on YouTube which promote Ayurvedic Netra Basti as a form of treatment for dry eyes. Please do read up about this treatment form and let me know your thoughts below in the comments section. Essentially, what this treatment entails is an eye bath, which is composed of a physical dough barrier placed around the eyes, and then this dough barrier within the center is filled with a product called ghee. Service providers of this particular treatment come out with extraordinary claims such as improvement of eyesight, relief of eye fatigue, cure of double vision, slowing of deterioration of the back of the eye, which is called the retina. Also, because the eye is connected to the brain, apparently this treatment can also help to improve brain function. The question one needs to ask themselves is, if such a treatment option is fantastic, then why are healthcare institutes across the world not endorsing for it to be used within hospitals and on patients? And leading on from this point, why are eye care professionals tending to engage in long-term management of conditions with their patient through the use of artificial tears, which, as I mentioned, is the mainstay of treatment, when they potentially can engage in practicing Ayurvedic Netra Basti? Is Ayurvedic Netra Basti a quick fix solution from needing to use drops to treat dry eyes? I am very keen to learn more about this particular treatment option, so please do get in touch and comment below and let me know what your experiences are with this treatment and what evidence for it exists. If you have had the treatment or you provide the treatment, please do comment below so that we can create a dialogue about this treatment option, as well as making these videos to try and educate others. I am also here to learn myself. That brings me to the end of this particular video. Thank you very much for watching this video. I hope you have learned what dry eyes are, what causes them, how the condition is diagnosed, and how the condition is treated. Again, thank you so much for watching this video. I really appreciate you spending your precious time with myself. I would be very grateful to you if you could help to grow my channel by doing simple things such as commenting, liking, and subscribing. Until next time, remember, if we truly understand why we are experiencing and why we have a certain condition, we are in a better position to try and treat it and understand the principles behind the treatment options and why they may or may not work.